We scratch our heads to fix yours. 80% of people experience major pain in the form of an injury in their lifetimes. So by the numbers, you or someone you love needs an injury solution but isn't sure who to see. Our own history is quite organic. You spoke and told us what you wanted, so we listened. It was a family-centric clinic that concentrates on communication and results that was the order. What we do is as follows. We thoroughly assess your specific problem, then we scratch our heads. And scratch. And scratch. Once we have figured out what is wrong, we explain how to fix it with unique treatment plans. If you're in, yippee! We go ahead with the plan performing treatments like manipulations, massage, stretching and strengthening or even acupuncture. We monitor results, change if it isn't working and keep going if it is. If, however, after scratching our heads and we can't help, then we'll tell you then and there and refer you to someone who can. So have you come to the right place?
Before we take a look at the meaning of specific anatomical terms, I suppose the first question we should answer is, why do we use anatomical terms? Well, anatomical terms exist so that we can precisely describe the location of features on a body. Let's imagine the following scenario. Here is a female. She's upset, and it's not just because she's naked on YouTube. It's mostly because she's just discovered a rather large pimple on her stomach. But where exactly on her stomach is it? Statements like "there's something on my stomach" are so vague and non-specific that they don't really mean anything to an anatomist. Is the pimple here, or here, or here? But if we use correct anatomical terminology, it's possible to precisely identify the location of her pimple or any other body feature so that anyone can precisely locate it. For example, if we're told that her pimple is 2 centimeters superior to her navel or belly button, then its location becomes obvious to everybody, which is probably not what this female wants. Before we move on from this picture, take a good look at how the woman's body is positioned in this drawing. Note how she's standing upright, arms at sides, palms facing forwards, and feet together. We call this the anatomical position, and it's the international standard position in which structures of the human body are described. Whenever you use anatomical terms, always apply them to a person standing in the anatomical position. Never apply them to, say, a person sitting on the ground or upside down or bent over sick after a heavy night out. Okay, let's look at some anatomical terms. The first terms that we're going to define are the terms left and right. Now, I know what some of you are thinking. Didn't we learn this in preschool? Well, even though you might think that the definitions of left and right are straightforward, many students actually use these terms incorrectly. You see, when we use the terms left and right, we're referring to the left and right sides of the person standing in the anatomical position, which in this case is the woman in this drawing. We are not referring to the left and right sides of the observer, which in this case would be you looking at this drawing. Consequently, for the woman in this picture, this is her left side and this is her right side. So if you were asked in a test to describe the position of, say, point A relative to the umbilicus or belly button, the correct answer would be point A is to the left of the umbilicus. Okay, next are the anatomical terms anterior and posterior. Anterior means front of the body, whilst posterior means back of the body. In humans, you can also use the term ventral for anterior and dorsal for posterior. Here are two examples of how you might use the terms anterior and posterior in a sentence. Example 1. The navel or belly button is on the anterior or ventral surface of the body. Example 2. The heel is posterior or dorsal to the toes. Next are the terms superior and inferior. Superior means above or towards the head. Inferior means below or towards the feet. For example, on this drawing, point A is superior to point B. However, point C is inferior to point B. Next are two anatomical terms that you probably haven't heard before. They are proximal and distal. These terms are only used to describe the location of 2 points on the same limb, which could be either an arm or a leg. Proximal means closer to where the arm or leg inserts into the body. Distal means further away from where the arm or leg inserts into the body. On this arm and leg, red arrows indicate proximal, whilst green arrows indicate distal. We can use the terms proximal and distal in the following ways. On the leg, the knee is proximal to the ankle because the knee is closer to where the leg inserts into the body. But on the arm, the wrist is distal to the elbow because the wrist is further away from where the arm inserts into the body. Remember, only use the terms proximal and distal when referring to 2 points on the same limb. If a point is no longer on a limb, like point A in this drawing, then you can't use the term proximal anymore. Instead, point A would be superior to point B. Next are the terms medial and lateral. Medial means any point closer to the midline of the body. The midline is an imaginary line that cuts the body in half vertically. Lateral means any point away from the midline. For example, in this drawing, point A on the leg is medial to point B because point A is closer to the midline. Alternatively, you could say that point B is lateral to point A because point B is further away from the midline. Another example would be your thumb being lateral to your little finger on your hand. Okay, now that you've mastered the basics, try to answer the following question. Using correct anatomical terminology, can you describe the position of the nose relative to the eyes? I'll give you 5 seconds to work it out. Hopefully you answered the nose is medial, inferior and anterior to the eyes. So far, all of the anatomical terms that we've described are what we call directional terms. That is, they're terms that describe the position of one external structure relative to another. But what happens if we want to observe the relative locations and arrangements of internal structures and organs, like for example the heart, lungs and brain? Well, to do this we need to cut the body into slices called sections or planes. The 4 anatomical planes are sagittal, frontal, transverse and oblique. A sagittal plane is a lengthwise or vertical cut that divides the body into left and right portions. If the cut passes through the midline of the body, then we call this a mid-sagittal plane. However, if the cut doesn't exactly pass through the midline, we call this a parasagittal plane. Next is the frontal plane. This plane divides a body into anterior and posterior portions. For example, a frontal section of the head would divide it into the face part and the back of the head part. Next we have the transverse plane. This is a horizontal cut that divides the body into superior and inferior portions. Finally, there is an oblique plane, which passes through the body at, you guessed it, an oblique angle. The importance of understanding planes becomes obvious when you look at these 3 drawings of the brain cut in sagittal, frontal and transverse section. Note how different each brain section appears, and how some features, like for example the pons, are easy to see in one section but difficult to observe in others. Thanks for watching.
The human spine is made up of 24 spinal bones called vertebrae. The vertebrae are stacked on top of one another to create the spinal column. The spinal column gives the body its main upright support. From the side, the spine forms three curves. The neck, called the cervical spine, curves slightly inward. The mid-back, or thoracic spine, curves outward. The outward curve of the thoracic spine is called kyphosis. The low back, also called the lumbar spine, curves slightly inward. An inward curve of the spine is called lordosis. The lumbar spine is made up of the lower 5 vertebrae. Doctors often refer to these vertebrae as L1 to L5. The lowest vertebra of the lumbar spine, L5, connects to the top of the sacrum, a triangular bone at the base of the spine that fits between the two pelvic bones. There is a joint on each side of the sacrum that connects the sacrum to the pelvis. This joint is called the sacroiliac or SI joint. Each vertebra is formed by a round block of bone called a vertebral body. The lumbar vertebral bodies are taller and bulkier compared to the rest of the spine. This is partly because the lumbar spine has to withstand pressure from the body weight and from daily actions like lifting, carrying, and twisting. A bony ring attaches to the back of each vertebral body. When the vertebrae are stacked on top of one another, these rings form a hollow tube called the spinal canal. This bony tube surrounds the spinal cord as it passes through the spine. Just as the skull protects the brain, the bones of the spinal column protect the spinal cord. The spinal cord extends from the brain to the L2 vertebra. Below this level, the spinal cord splits into a bundle of nerves that goes to the lower limbs and pelvic organs. The Latin term for this bundle of nerves is cauda equina, meaning horse's tail. As the spinal cord travels from the brain down to the spine, it sends out nerves on the side of each vertebra called nerve roots. These nerve roots join together to form the nerves that travel throughout the body and form the body's electrical system. The nerve roots that come out of the lumbar spine form the nerves that go to the lower limbs and pelvis. The thoracic spine nerves go to the abdomen and chest. The nerves coming out of the cervical spine go to the neck, shoulders, arms, and hands. It is sometimes easier to understand what happens in the spine by looking at a single spinal segment. The spinal segment includes 2 vertebrae, the intervertebral disc between, the 2 nerve roots that leave the spinal cord at that level, and the small facet joints that link each level of the spinal column. An intervertebral disc is made up of 2 parts. The center, called the nucleus pulposus, is spongy and acts like a shock absorber to cushion the force between each vertebra. The nucleus is surrounded by a series of strong ligamentous rings called the annulus fibrosus. Ligaments are made of strong connective tissue and connect one bone to another. The annulus fibrosus is actually a special ligament that connects 2 vertebrae together. Between the vertebrae of each spinal segment are 2 facet joints. The facet joints are located on the back of the spinal column. There are 2 facet joints between each pair of vertebrae, one on each side of the spine. A facet joint is a small bony knob that sticks out from the vertebral body at the back of the lumbar spine. Where these knobs meet, they form a synovial joint that connects the 2 vertebrae. The facet joints of the lumbar spine move together in a sliding motion as you bend forward and backward. The surfaces of the facet joints are covered by articular cartilage. Articular cartilage is a smooth, rubbery material that covers the ends of most joints. It allows the bone ends to move against each other smoothly, without friction. 2 spinal nerve roots exit the sides of each spinal segment, one on the left and one on the right. As the nerves leave the spinal cord, they pass through a small bony tunnel on each side of the vertebra called a neural foramen. The lumbar spine is supported by a complex set of ligaments and muscles. The ligaments are arranged in layers and run in multiple directions where they connect the bones of the lumbar spine to the sacrum and pelvis. The muscles of the low back are also arranged in layers. Those closest to the surface are covered by a thick tissue called fascia. The middle layer runs up and down over the lower ribs, chest, and low back. They blend in the lumbar spine to form a thick tendon that binds the bones of the low back, pelvis, and sacrum. The deepest layer of muscles runs along the back surface of the spine. These muscles connect the lumbar vertebra, pelvis, and sacrum and coordinate movement with the muscles of the abdomen to help hold the spine steady during activity.
If you have low back pain, you're not alone. Most people in their lifetime experience one or more episodes of low back pain. In most cases, the pain goes away within days to weeks. However, it can last for 3 months or more. These extended episodes are defined as chronic low back pain. The common treatment approaches for low back pain include exercises, relaxation techniques, and medications. To understand how these treatments work, let's first look at the structure of your lower back. The spinal column is made up of 24 vertebrae. Back problems and back pain commonly occur in the lumbar region. Each vertebra has an opening that forms the spinal canal and protects the spinal nerves. Facet joints and intervertebral discs connect the vertebrae above and below. These structures are held together by groups of ligaments and muscles. Muscles attached to the spinal column allow us to move, and they also support the spine, bearing the body's weight. If some of these muscles are tight, weak, or imbalanced, pressure can result in excessive wear and tear of other structures. For example, a common problem in the lower back is disc herniation. In this case, pressure on an intervertebral disc has caused its center, the nucleus pulposus, to protrude backwards and push against the spinal nerves, resulting in low back pain. For some patients, the pain can also be felt in nearby areas where the spinal nerves from the lower back also extend, such as the leg and foot on the affected side. Exercise can relax muscles and reduce pressure in the lower back structures. It is important to consult your health team to determine which exercises are best for your condition. Consider one common low back pain exercise program called the McKenzie method. For patients with posterior disc herniation, lying in a prone position reduces the pressure on the disc. If the pain condition allows, performing extension movements can gently stretch and relax tight muscles. Your lower spine also becomes more arched with time, bringing the disc center forward into the correct position and reducing the irritation on your nerves, therefore decreasing the pain in your lower back and legs. The benefit of exercising is more than just reducing the pressure on your lower back structures. By integrating back exercise into your daily routine, you can condition your abdominal and back muscles, referred to as core muscles, and therefore prevent low back pain from happening again. For some patients, relaxation techniques such as meditating in a relaxed position, as well as cognitive behavioral therapy, can ease back pain. This is because our brain not only perceives pain, but also regulates pain signals. When back structures are damaged, pain signals ascend from the lower back through the spinal cord, arrive in the brain region that perceives pain, the sensory cortex. However, this is not a direct route. At least 2 connections have to be made. It's at these relay stations, which include the spinal cord and the thalamus, that pain signals can be regulated by the brain. Let's take a closer look at the first relay station, located in the dorsal horn of the lumbar spinal cord. Here, The incoming pain signals are passed from a sensory neuron in the lower back to a relay neuron in the spinal cord. The pain signals then ascend up to the brain. This pain impulse can be reduced by a specific type of neuron carrying signals back from the brain. As a result, fewer pain signals are sent to the brain, so we feel less pain. However, if for instance you are stressed, these brain signals can increase the pain signals. Therefore, studies show that patients with depression or anxiety experience more pain, while patients who have positive attitudes and are engaged in their treatment feel less pain. Your health professional may also suggest that you take pain-relieving medications that fit with your existing medication regimen. The effects vary greatly, depending on what type of medication is prescribed. Some medications help relax muscles, and some act on the neurons in the relay stations to reduce the pain signals. It is important to follow the advice of your health team and do exercises, learn relaxation techniques, and perhaps take medications. The benefits might not be felt right away. It takes time and your active participation. By taking an active and informed role in your own health, you are guaranteed to better control your pain and lead a healthier life.